Hi parents. Okay, so today I'm going to be doing the newborn exam. This exam is to check your baby from literally the top of their head all the way down to the bottoms of their feet and making sure that everything is within normal range. So we're checking their eyes, their ears, their mouth, their nose. We're going to check their heart, their lungs, their abdomen, the rolls on the back of their legs, their spine, creases in the bottom of their feet, all their reflexes and all the things. Before I start, do you have any questions for me or any concerns? Sorry, my kids are home and sorry if they're loud. Okay, so would you have any questions before I start? So hopefully they would say no, or I would answer any follow-up questions or concerns that they would have. Today with me, I'm going to be referring back to my checklist. So this is my checklist that helps me make sure that I am not missing anything. There's a lot to look for on the newborn exam. Sorry, page stuck together. There's a lot to look for here on the newborn exam. And then my last page is just the Ballard score that I would be using. So this like cheat sheet is really helpful. There's a lot of things to look for on your newborn today, so I'm going to be referring back to that and checking things off as I go. So before I start with Sweet Debbie, I'm going to go wash my hands, and I'm going to put on gloves, which I don't have here with me today, but I'm putting on gloves. And I'm making sure baby is nice and warm. I'm going to take baby's temperature before I start. And then I have a heating pad here. I like to keep them wrapped as much as I can, but there are times during the exam where I have to take this off and to be able to look at their full body. So, hi, Sweet Debbie. So today we're going to be starting your newborn exam. Mom and Dad or your parents are right here, so I don't want you to be scared or nervous. We're going to finish this exam and you're going to go right back on the chest and be nice and warm and can snuggle in. So, all right, first I'm going to check your temperature. I'm just wiping any vernix away from underneath their arm or any wetness. Taking their temperature underneath their arm. Just beep, beep, beep. And temperature says it's 97.6. So that's great. 97.6 is a really wonderful temperature. We want to make sure that baby's above 97.0 but below 100.4. We don't want them to have a fever, which would be over 100.4 or 100.4 or over. And we want to make sure that they're above 97.0. Newborns have a really hard time maintaining temperature for the first couple days of life. So we do want to make sure that they're bundled up and that they're not wet or anything like that. Everything that they have on is nice and dry. So one of the things that I do is first I do the Moro reflex. So this is when you kind of hold baby's arms up and you let go and they do the startle. So that is normal. It's symmetrical on both sides. So that's great. All right, Sweet Debbie, we're gonna start your exam now. So the first thing I'm looking for on your baby is their skin. So I'm checking out all of their skin. So I'm gonna pull this down. I'm looking for any bruises, any lesions, any lumps or bumps on their skin that appear not normal. I'm looking for any birthmarks, any signs of jaundice. Jaundice is not normal within the first 24 hours, so we're looking at that at the newborn exam. And then we're also looking at the vernix. The vernix is that cheese-like substance that kind of covers their skin and protects it from the amniotic fluid. And we're looking at the lanugo, which is the hair on their skin that can be very present, and then as they get closer to gestation it kind of starts to thin and fall out. So most babies shouldn't have a ton of it. If they do have a ton of it, that can be an indication that this is an earlier baby. So I'm looking at that. Everything appears really normal. Looking under their arms for any lesions, any concerns. Turning them over, looking at the back of their head, their back, their legs. Everything appears really normal. There's also no peeling on the baby, so that's great. So awesome. So there's no concerns, no rash or anything like that on baby. Next, I'm going to be looking at the baby's head. So the first thing I kind of look to see if there's any caput or any cephalahematomas, that would be like swelling on the baby's head. If it crosses the suture line, if it doesn't. And then next I would be feeling for the anterior fontanelle to see if it's open or closed, if it's soft, smooth. So this baby's is normal. It's open in the front, it's soft. And then as I'm doing that, I'm feeling the baby's suture lines to see if there's any overlapping. Overlapping suture lines is normal. As they get squeezed through the birth canal, their head molds to fit. So I'm examining all the suture lines, the sagittal suture line, the coronal, the lambdoidal, and the sagittal is overlapping and the lambdoidal in the back is overlapping. And then the posterior fontanelle is about 1 finger breadth open. Again, appears really, really normal and no concerns there. So I'm just going to check some things off and document as I'm doing this. Okay, great. Next, I'm going to wrap your baby back up to keep her nice and warm as I'm doing this, because next I'm going to be checking the head. So checking the face. So while I'm checking the face, I'm checking for a lot of different things. I'm checking for the shape of their face. And does everything appear symmetrical? So that already appears really normal. Next, I'm checking the baby's eyes. So I'm checking the space between their eyes. I would measure that to make sure that is normal, and that appears great. And then I'm checking the shape of their eyes. Again, that appears normal. I'm looking at their eyes to see if there's any broken blood vessels or any bleeding or anything that seems concerning. And then any evidence of jaundice in the whites of their eyes. And then I would check for the red light reflex here using my light. I'm shining the light in the eyes to make sure that there is a red reflex that shines back at me, and there is. So that is also great and normal. Next, I'm checking for the baby's ears. So proper position of the ears. Are they symmetrical with the eyes? Are they too far forward? Are they too far back? Nope, everything looks great and normal there. And then are they responding to sound, which we could see earlier. And then the shape of their ears, does everything seem like it developed normally? I like to just glance inside and make sure I can see inside their ear. And then I also like to flip their ear over and make sure that it's like fully closed in the back and there's no like holes or abnormalities there. Okay, so I would document these findings. Everything, again, like I said, is normal. And then I'm looking at the shape of their nose and the patency in both of their nostrils. So the nostrils appear open. They seem like they're breathing normally. And then the shape of the nose is normal. There's no concerns there. Okay, so I would document that and everything is great and appears normal. Now I'm looking at their mouth. So is the shape of their mouth normal? Or are their lips fully formed? And then with my gloves on and my clean hands, I would put my finger palm side up inside their mouth. I'm feeling at the top, like the roof of their mouth, and making sure there's no holes or separations there, to make sure everything's intact and there's no like hidden cleft palate or anything like that. That's okay. And then, so their sucking reflex is really normal and their palate is intact. And like I said, the shape of their mouth, lips, and their tongue also, I'm examining their tongue when I put my finger in their mouth. Is it coming really far up onto my, the back of my finger, or is it really pulled back? Those can all be signs that there might be a lip or tongue ties. And yeah, I'm just feeling around for any other abnormalities. And then I'm also checking for their rooting reflex, so rubbing the sides of their cheeks, and they'll turn to want to nurse when that happens. So that is all great and really normal. Next, I'd like to take my fingers and kind of walk them down to the back of their neck. A feeling for any masses, any big lumps or bumps that are not normal, and I'm not feeling any of that. I'm feeling their glands there. I'm also having the baby gently saying, go ahead and which normally I kind of walk my fingers like this. So you kind of walk your fingers and the baby usually turns. And then I kind of walk my fingers over this way and the baby usually turns. Little harder with a mannequin, but it works. And then, so yeah, range of motion seems really normal. Babies can sometimes have a tender neck after they're born, but this baby Debbie, seems really, really great.
Baby Debbie?
Yeah, that's her name. So I'm going to chart all of that. And then next, I'm checking as I'm moving down from her neck. I always check their clavicles at that point to make sure that they're both intact. So that is normal and awesome. Okay, now moving down, I'm checking their chest, checking the nipples to make sure that they're both symmetrical and formed. And I'm also feeling for the breast buds. So those are about 1/2 centimeter, like 1 millimeter. Yeah, those both appear normal. So I would check that. I'm also checking when I'm checking their chest that there's no retraction, that there's no pulling, like they're having a difficult time breathing. That there's not like asymmetry in their chest when they're breathing. Hey, bud, I'm trying to do this, honey. No, you can't. I'm sorry. You can sit here if you want, but we can't play around with all this stuff. No. So, bud. Okay, thank you. No, like there's no asymmetrical in their chest. It's not like as they're breathing, it's coming up and going down. And, yeah, so those are all the things I'm checking there. And then I would document to make sure that all of that is normal. So arms and hands. So one of the things that I'm checking as I'm moving down on their hands is I'm going to check their grasp reflex and like the lines in their hands. So I would put my hands, it's hard with this doll because the hands are closed, but put my hands on here and I would make sure that they're grasping down on onto my fingers. I'm checking the lines in their hands. I'm checking their nails, making sure that they do have 5 fingers on each hand and that there's no less or no more. And then I am going to check that off on my checklist. Palm creases can be indications that there might be something genetic going on. So that's why we check that there. And then next I would take my stethoscope. Can I have that, sir? Thank you. And I would start my timer. Start my timer. And I would listen to baby at this point. So I'm listening to the 4 chambers of the baby's heart. I'm listening for the lub-dub sound. And I'm listening for a full minute. I like to check the 4 chambers of the heart first to make sure I'm hearing everything that sounds super normal. And then I would place the stethoscope and listen for a full minute. And I'm listening all the way through. Bud, please stop. Okay, so baby sounds great. Their heart sounds really normal. There's no abnormal fluttering sounds or anything that seems weird. And, sorry, very distracted. And normal fetal heart sounds. So, or normal newborn, normal respiration. Wow, normal heart rate. Sorry. Took a minute to get out, so sorry. A normal heart rate for baby. Baby's heart rate was 128, and that seemed really great and normal. Okay, so at this point, I like to listen to baby's lungs. Finley, please come here. Here. You can play with this after, but I'm doing something. Okay. So after I listen to the baby's heart rate, I need to go play. I'm almost done. So once I listen to their heart, I often listen to their lungs. So I like to turn that, maybe I should do it this way, turn them over. And I'm listening to 3 points on their back. Again, I'm listening to make sure that their lungs are clear, that there's no like abnormal crackling sounds. And then I'm listening in 3 places on each side. So I'd like to listen, and then I would listen for a full minute to count their respirations. This baby's respirations are 52, and normal respirations are between 40 and 60. So that appears really normal. And then while I have my stethoscope on, I'm also going to be listening for sounds of their abdomen, bowel sounds, to make sure everything appears normal. So listen again. And that appears great. Okay. All right, sir. You may take that if you need to. Okay, and then I would document all my findings for heart and lungs. Again, no crackling sounds, no abnormalities with the lungs, that they sound clear, that they are filling up and going out. And then again with the heart, that there's no arrhythmias, no murmurs, nothing that seems abnormal or scary. So this baby seems very, very normal. Everything with it is within great range. So now I'm about here at the abdomen on the baby. So I'm gonna feel around for in the abdomen for any masses, anything that feels abnormally hard. There are gonna be lumps and bumps in there. There's organs, right? But nothing that's like concerning. Nothing that feels abnormal. No like hard masses that feel super firm. And then I would also. Okay, you need to step up, please. Okay, then you need to stop. Sorry. Okay, then next I would examine the baby's umbilical cord, or their belly button. So umbilicus, I'm checking to make sure that it's central, that there's no hernias there. I'm also looking at the umbilical cord to make sure it's 2 arteries and 1 vein, which it is. So that is great and normal. And then I'm also checking for their femoral pulses right here. So running my hands down, pressing down, not too firmly, and then I would clock that. And that is great. They're both there. They're both symmetrical. So that's important. Then I would document that. Next, I like to go down to the bottom, making sure that their skin and everything is normal on their knees and legs. And then I like to pick up their feet. I like to count all of their 5 toes on each foot. And then I'm looking at the bottoms of their feet to make sure there's no crack, like skin crackling, peeling, anything like that. And I'm looking to see if this baby has creases on the bottom of their feet. If it's super smooth, then that means that the baby is more like a preterm. And if they have lots, like full prints, then that means they are more, not post-term, but like post-term or full term at around 40 weeks. So that is great. So I would document that finding. And then I turn baby over. Oh, sorry. Before I turn baby over, I'm going to be checking their genitals. So baby Debbie is a female. So I'm going to be looking at her labia minora and majora and making sure everything is normal. I'm also checking her bottom at this point to make sure that her anus appears normal, intact, and that there's no concerns. So everything seems really normal with them. Baby already peed, so we know that that works, and baby passed meconium on their way out, so we know that that works. Okay, so this baby's head doesn't turn very well, but when you lay baby down, I like to always make sure that their head is turned. So next I'm looking at the baby's spine. So I like to run my fingers down their spine. I like to kind of hold them like this to make sure that that is normal. Checking for any dimples at the bottom of their sacrum. Any openings, that would be a sign of spina bifida, so that would need to be looked at right away. So all of that appears normal and great. Yes, I do need that. Can you get that and bring that to me, please? So yeah, and then no tufts of hair at the bottom of their spine, that their spine is closed, and that there's no discolorations or anything like that that we're concerned about. So next I would do, at this point too, I also check the baby's legs to make sure that their rolls and their legs are matching up, to make sure that that's normal. And then at this point we get to do the fun stuff. So I'm gonna measure baby's head. Measure baby's head. So that is normal. That is 13. And then I would move down. I would measure their chest. So that is 13 and a quarter. And then their abdomen, which is 13 and a quarter. So that is normal. And then I'm going to do the baby's length. This is always really tricky, but do the baby's length. Make sure that their legs are all the way stretched out. So this baby would be 21 inches. So great. Don't touch, please. I'm almost done, honey. I'm almost done. Okay. One second. And then at this time, do you guys want to do eye ointment or vitamin K? Hopefully, I mean, we would have already talked about that and had an answer. So at this point, I would administer the eye ointment into their eyes and the vitamin K into their thighs. And then I would document at what time I found that. So your baby, Debbie, seems really normal. Everything is within range and there's no concerns. So the next thing that we're going to do is we're going to go through the Ballard score. This helps us to determine the baby's gestational age. So the first thing that we're going to do, I have my paper here that I'm looking at. So the first thing that I'm going to do is I'm going to look at the posture of the baby. So baby is, this baby's arms are kind of up and their legs are kind of out like this. So I would give this baby a 3. Next, I'm looking at their wrists. So I'm going to take their wrists. I'm going to fold their wrists down for a Finley, please stop. For a preterm baby, their wrists wouldn't really be able to flex. And then for a more post-term baby, their wrists would go all the way, all the way down to their forearm. So this baby, I would give about a 3. It goes down about at a 30-degree angle. And then, and then next I'm checking for their arm recoil. So this is checking for their elbows. So I take their arms and I put them up like this, and then I bring them down, and baby's arms go right back up kind of to their side at about a 110 to 140 degree angle. Please, bud, this isn't helpful to mommy. I want the baby to hear my voice. Okay, well, you can wait and baby can do it in a minute. So the arm recoil, yes, so put the baby's arms like this up, down, and then baby's arms come right back up. So this baby I would give about a 2. And then their popliteal angle. So I am checking for the angle of their knee. So putting their thighs up, and then I'm checking at this angle. So this baby's angle is about, I would give them a 3 because it's about 100 degrees there. Okay, and the scarf sign. So this, I'm pulling baby's arm and elbow over their chest. And this baby is about, I would give them about a 3. It comes pretty far over. Finley, can you come here for a second? I'm sorry. Come here for a second. Let me see. Okay, let me see, please. Thank you. I will have to start over if we can't listen. Okay, then I'm checking the baby's heel to ears. So bringing baby's legs all the way up, and then seeing how far that they are able to come up. So again, I would give this baby about a 2. So their overall score for the first section is 16. So I would write that down. And then I would do, Finley, look at mama. I have one more section and then I'm done. Okay. Next, I would do the maturity section. So this is the bottom section. So I'm checking for skin. Because I already checked on the newborn exam, I would just make sure that I have my memories right, and I'm working with the not remembering something from another birth. So there's no cracks, there's no peeling. Their skin is, let's see. Okay, so this baby is, so there is a little bit of crackling on their skin, and there's Sorry, I'm just trying to decide which one I'm doing. There's a lot of distractions, so sorry. Okay, so I'm checking the baby's skin. For a baby that is preterm, that their skin would be super thin, you'd be able to see all their veins. And then post-term, their skin's really, really leathery. So this baby's somewhere in between. I would give this baby a 3 because there are some cracking, but other than that, there's everything pretty much appears normal. There's some rare veins, so everything I would give baby about a 3. And then the lanugo, so that's the hair on the baby. Again, if they're super post-term, that hair would be mostly bald, no hair all over the baby. If they are more preterm, then there would be more hair on the baby. It'd be like sparse, like. Sorry. Okay, so if the baby is more preterm, depending on where they are being preterm, sometimes there won't be any, or it will be sparse. And then if baby is scoring about a 1, then there would be an abundance of hair. So depending on where they are in being preterm versus postterm is depending on how much hair they have on their body. So this baby has bald areas, so I would give this baby about a 3. I'm always checking on the back, on their legs and arms to determine if they have hair. Okay, I'm almost done. And then lastly, not lastly, but almost lastly, I'm checking the plantar surface. So this is the feet. Again, I'm checking to see. Almost done.
I want to help you.
You can help me in 1 second. The plantar surface, I'm checking the creases. So this baby has about 2/3 creases on the bottoms of their feet. If they are really, if they are a preterm baby, then their feet will be super, super smooth. And if they are like a full-term baby, then they'll have full creases on the bottoms of their soles. So this baby has about 2/3. So again, I would give them a 3. Then I'm going to check for their breast buds. I think I said earlier their breast buds were about 1 to 2 millimeters. And so I would give that baby about a 2. And then I'm checking for their ears. So ears and eyes, are their eyes fused? That would be more preterm. Or are their eyes open and appear super normal? That would be post-term or like normal gestation. And then I'm going to check their ears also. So the pinna is the flat and the like how they can recoil. So I'm checking their ear. I'm checking to see, folding it over to see if it will go right back or if it will stay. This baby, I would give a 3. And then this baby is born female, so I'm checking their genitals. I am going to say that the labia majora is larger and the labia minora is smaller, so that would be about a 3 for this baby. Again, so I'm checking all of these parts to make sure that their gestational age or what their gestational age could be. If we are at a birth and we are concerned if this baby is super late or super early, this would be the time that we would do the Ballard score to determine if their dates were super off or if we were pretty accurate. So for this one, the top score I got for the neuromuscular maternity is about 16, and then the bottom score maturity, and then the bottom score is the physical maturity, so that is 17. So that would give me a score about 33. And then on my chart, that means baby would be between 30 and 35, which would mean that they are between 36 and 38 weeks gestation. So little Debbie is not at more the 40-week range, but yes, right in track and right on track. And then the last thing that I would do right before I hand baby right back to mom, baby's definitely ready to get back to mom at this point, is just weigh baby really quick and put baby right back on mom's chest. Okay, that is my newborn exam. And then I would just check in with mom and make sure mom and dad or parents make sure that they have no questions at this time.